Okay, thanks everybody for your patience. Please note that we are being live streamed through YouTube. Today is May 17th, it's 12:33, and I'll officially call the Greater Boroughs Partnership for Health Advisory Committee meeting to order. I guess, yeah, we'll still have to go through our roll call vote on attendance. So if after I call your name, if you could just unmute and state your name and say present or aye. So let's start with Sarah Barrett.
Sarah Barrett, present.
Thank you. Anne-Marie Muckenstrom.
Anne-Marie Muckenstrom, present.
All right. And Chelsea.
Chelsea Malinowski, present.
Thank you. Heather.
Heather Alker, present.
And we'll officially note, I'll note that Taylor West from Southborough is also in attendance, as well as Isabella Caruso and Aaron Coulard. My Shanahan, why I'm having a moment, Aaron, of like both last names are in my head. So, okay, so we'll move on. Isabella's going to help us out, and we are covering a bunch of budget items, which is a little number intensive. So we're going to work through a PowerPoint presentation. So Isabella, if you could help with sharing that. Okay, so just a quick recap on the agenda. You should have received an email from Isabella yesterday, just resending all of you the agenda minutes, several attachments that we'll be going over today. And so again, we'll start off, we're going to go over, most importantly, our Public Health Excellence Grant, our PHE grant, as we call it. That's our primary grant. That does have an upcoming budget due date and a work plan due date. So majority of this meeting is going to be focused on that. Again, this group meets 4 times a year, but this is an additional meeting that was added to go over the budget. We'll also start to frame out the contact tracing budget as well. We'll have a quick update on disease investigations. We have one set of meeting minutes to approve, and we'll confirm our future meeting dates and take any other discussion or questions. So next slide. All right, so we are in our budget cycle season. We're ending our second year of the budget, which is fiscal year 23, and getting ready for fiscal year 24. So all of you should have received an email with the great and exciting news that the Massachusetts Department of Public Health has awarded our PHE region an additional $160,000 for this fiscal year. So that new fiscal year 24 budget is shown on the screen. We have started drafting the budget, really just plugging in everything from last year, you know, accounting for some increases, COLA merit adjustments that are likely to happen, salary, fringe benefits, and health insurance. We'll talk about, and we'll show you that next slide in the budget in a minute. Moving the epidemiologist position was originally hired under the contact tracing grant. That grant is still there. It will be there through fiscal year 24, but is not going to exist in fiscal year 25. So many of the shared partnership for health regions like ours are moving those key positions into the PHE, which will ensure that those positions can persist in the future. So that's one thing we're looking to do. And we have done some modest increases to our health communication, inspectional supplies, membership fee, nursing supply, technology, hardware, and travel line items. And we'll cover those in the next slide. And one of the things you all had for homework as we sent out this meeting invite was to think about other projects, needs, programming, and we'll talk about that today. We're anticipating a surplus or unallocated fiscal year 24 amount of somewhere between 50 to 70,000. So depending. So next slide, please, Isabella. Okay, so I'll just walk you through. This is just a screen grab or screenshot Isabella has placed into this to cover what the budget looks like. So this is the state's form. It's very similar to what we did last year. So again, the health agent, I'll just walk through what's the easiest. Nursing, that hasn't changed. So that was really a set contract price with Sam and VNA. I do have the fiscal year 24 contract from them already. So that is a locked in price that's staying static for the first 3 years of grant. 1.5 positions. Again, this is what funds Erin, Jim over in Westboro, as well as a few hours for Celeste Kopek, who covers the senior center in Northborough for a few set hours. So that gets us to that 1.5 positions. It's contract with Sam and VNA. So absolutely no change there. I just want to note that that amount 131,000 is inclusive of fringe, benefits taxes. So as you go down on the screen and you see at the very bottom, the last, second to last line, fringe benefits, payroll taxes, that does not include the contracted nurses. So those numbers at the bottom on fringe benefits and payroll are just based off of the shared services coordinator / epidemiologist, as well as the health agent. The only thing that's just a little quirky in reading, you could see this justification, the health agent position, Michael Seeger, his position again is, it's a full-time position, but the town of Northborough, since we started this, pays $13,000 from our line item. So it is reflected that it is a full-time. However, that $64,000 we're estimated is less the $13,000 that Northborough pays out of their general fund budget. So that's there. And then the change here is last year we did have, this current fiscal year 23, we did have the line item for the shared service coordinator at 0.4. What's new this year is that we're moving that epidemiologist line item, and DPH says it's perfectly okay to have a split role position, and they just want it reflected that way on the budget. So right now that's Isabella who's filling in. It's that set. So 0.4 times 2 is 0.8. That's really the 32 hours. And that's the amount of hours that work for Isabella and her schedule. As you know, she's still working towards her PhD. And so we think that's a reasonable amount of time as we continue through fiscal year 24. So those are the hours we're looking at. And I guess I'll open it up to comments or questions regarding salaries.
Well, I think you answered it. Health agent for 1.0 FTE, just from I remember from the prior health agent, I thought it was not a 1.0 because it was less than that, because some of the point something was from Northborough. So now you're saying the whole 1.0 is the greater boroughs. No, but then some of the.
So
yeah, I thought.
So if you, well, you can't see, if you click on that cell in the interactive document, it's Michael's full salary less 13,000. So I tried to explain that in the justification. I think what we could do, whether we put that in as a, prorate it to something less the 13,000, because that's a set fee that I had in my line item that we were paying to contract a food inspector. We didn't want that to go, so it goes back into that. Because I'm not supplanting funds. I can talk to Cassandra at the state if she wants the 1.00 to be something like a 0.865 or whatever that number ends up being less 13. I'll probably defer to Cassandra how she wants that accurately reflected, that it's clear to the state. So I did, regarding the amount, that 64,000 is less the 13 from Northborough. So Michael's actual full salary for this year is, it's, you add those two, so it's around 77,000 is his full-time salary, but we're only putting in the line item, less the 13,000 from Northborough's budget. So any other questions regarding this section of the fiscal year 24 budget? And so I just want to say that I don't think you can see all the lines because the way they cut off in the view. The fringe benefits, we're just sort of basing this right now. Those are low right now because we're anticipating the health agent is not taking benefits. But I am sort of saving. So obviously, if there were 2 employees taking full family benefits, that amount would be like 35, 40. You're only seeing at 19. So we're just assuming that one of those employees is taking it, but I'm sort of saving that because obviously an employee has the right to elect that at the year change. So that's something where that number is low, only because we're estimating just based off their current employees that only one would be taking health insurance. So that's something to keep in mind, that the fringe benefits are low, but that's what we think is an accurate estimate. Any other questions or move on? Okay, next slide.
Sorry, Kristen.
Oh, yeah.
On the fringe benefit. So what percentage of full-time does Northborough grant benefits for?
We grant full-time benefits for anybody 20 hours or more.
Okay.
So for both of those, so both the nurses, again, that's contracted, so you're not going to see fringe.
Right.
So really Isabella's position is 0.8, so she is entitled to benefits as well as the health agent.
Okay, got it. Thank you.
You're welcome. Okay, next slide, Isabel. Okay, and so this sort of just continues down. So these were some line items where we're just estimating numbers. health communication, inspectional. We really looked at what we spent this year versus what we may spend next year. Again, we have a much clearer list of allowable uses from the Department of Public Health related to this grant. So again, we have the ability to pay those membership fees for your nurses, for example. However, everything I want to preface is we can't supplant existing funds. So one of the things that we have to submit this year, which is new, is when we submit our fiscal year 24 budget, each town has to give us a copy of your fiscal year 23 and your recently approved 24. And we didn't have to do that last year. So remember when we all signed our MOU or agreement to enter PHE through DPH, we said that we couldn't supplant funds. So if you do have a change to your budget, I'm gonna give you a good example for Northborough. We have always had our plumbing inspector under the Board of Health, not under building. And so my budget, you're gonna see a decrease in the town of Northborough's budget. And so we're not really supplanting funds because that's not related to public health roles. We're just more appropriately moving into building. So as you, Isabella will be sending an email following this meeting requesting your approved fiscal year 23 and 24 budgets for your towns. I know in Northborough, it's easier for me to request that from my accountant and he'll just print me the detailed munis report. But however it comes, I think they want a level of detail if possible. And if you have a decrease to your budget for any reason, could you please explain in a one-liner why? Because the state, I think that's really, they're just screening to say, are you cutting your budget? What they don't want us to do is take the grant and start cutting your public health budget locally, because that's not allowed. So if you have questions, you can talk to us offline.
Yeah, I think I already sent in to Isabella.
Okay, so great. So that's why they were asking for it. So again, with membership fees and some of those things, and even the additional trainings and credentialing line item, which is a little confusing. They sort of called that out at the very bottom. So 3 rows from the bottom, that's where the training and credentialing. So if someone needed to recertify, for example, for a food inspector, any certification, we do have the ability to pay any trainings for shared or even your own town's department staff, as long as it's not already in a budget line item under your local Board of Health. So definitely have some flexibility. We're estimating 1 new desktop station for Northborough. We had originally, when the first year of the grant, bought computers, but we are, we're hosting another intern for the 2nd year in a row. And we want to create like an actual workstation. So we're looking for that piece of equipment. And I think we budgeted 1 replacement iPad, just in the event that any of the deployed iPads would be problematic. Food and housing software is currently on this is static, but that's a discussion point. If we need to add any additional software, we estimated mileage and made sure to note that's the health agent as well as the epidemiologist and coordinator positions. So open up for a discussion on these items.
Well, I had wanted to ask, we got another food and housing software license in Southborough, how much that would be. It would basically mostly be for me. I know Barbara and Michael have one.
Okay. So is it to do inspections, or is it like administrative running of your sports or reports, or both?
I could do running reports for sure, but I have done just 1 or 2 follow-up housing I did under Michael's name. So
okay, so let's clean that up. Yeah. So and again, I'll pull out the numbers. I'll have to go back to relevant to get the exact number. I'm assuming they're going to honor what we had before. I think that's going to cost, I want to say, 1 new inspectional license under food and housing, $1,500 to $2,500, somewhere within that range. But again, I think we have the money there. Westboro already has more licenses than the other towns because they have more inspectors. So they have 3 inspectors. So they have currently in staff, it's Maria, Ray, and Jen have that access plus their admin. So I don't think that's outside the norm to have that. And I guess my only question, I'll throw it out to Boylston because they're here. Sarah, did you have any, Michael's covering your food and housing, but did you need any additional licenses as well?
Not that I'm aware of, and I spoke to Dennis right before we started this meeting. So no, he didn't make me aware of anything
Okay.
that he needs. So
Okay.
in terms of licensing, yeah.
Okay, that sounds.
And
Good.
Kristen, do you know if there's is there read only for reports access, or like you have to buy like the whole package when you get another license?
Yeah, I'm just pulling it up right now. Bear with me 1 minute from the original quote, and they locked us in for 3 years. On the following fiscal year, we'll be looking to see about a 10% increase. So we're also trying not to like max out this budget because we are going to see increases across
Yeah.
the board. So I'm just looking an annual subscription and administrative subscription is 360, but for an inspector, it's 1,800 a year.
Oh, I see.
I'm just looking at this. I want to make sure that's both food and housing. So I'll have to do the math. 14 inspectors. So yeah, so it's actually, Heather, if you're interested in the access, food and housing is separate. So it'd be 1,800 to be able to do food inspections if you need to do food, and 1,800 a year to be able to do the housing. So, you know, are you looking for?
Well, maybe I could just always go with Michael. Yeah.
Well,
I'll think about that for the year. I'll think about that.
so I have an issue though with security on that. So,
No, I wouldn't go alone if I didn't.
but if there's, sorry, Kristen, did you say there's a read-only report?
Yes, there is. It's 300. It's much
So
less.
I think that might be, and Heather, we can talk offline before we make a decision, but I think at a minimum, Kristen, we probably would look for the.
I need a read only for certain. I'll have to think about for the next year. I'll talk with Chelsea, think about whether it's an inspectional one. But we
Okay.
definitely want the-
Another administrative user is only 360 a year.
Right.
So that's
I'll
an
definitely
easy
want
add.
that.
Okay, so we'll do that. Regarding relevant software, I was just on with Mike Hicks, their, you know, director, owner extraordinaire, about a management report. And so they had talked about adding a tool or a reporting feature where you could do a, you know, director report, management report, like how many inspections. And so that was talked about, but they have yet to deliver. So there's no, I'm a little disappointed with the reporting features at this time. However, Heather, you can always contact Mike Hicks at Relevant. And I just did this exercise for the towns because, you know, Northborough oversees Michael. And so I just requested a report of all the inspections so they can manually run it. I don't think we want to ask for it all the time, but I'll forward you your reports. Sarah, as a follow-up to this meeting as well for Boylston. So you can see the list of all the food establishments, and the report feature is a little limited. It's just the last time it was inspected. So I did have a sit down, and Michael's very good at managing his time, and he has his own internal tracking and may have reached out and working with you. So he's on schedule to meet the requirements for the twice a year, once a year, depending on the type of food establishment. And so we'll definitely add the 360 there, and I'll talk to Mike Hicks to amend that. And then, yeah, not robust reporting management features, but there is some capability. So if there's a certain report or something you'd like to run, please reach out to me and I'll let you know if we already have it. Otherwise, we can look to request it, but we'll add the 360 if that works for the group. Okay. Any other questions on either the relevant software or any of these other line items? There were a few things we did as we developed this draft budget. We did go through the CART. So that was our assessment tool, you know, that we all had the meeting with BME. There were certain things that were called out in the CART. I don't think we were wow, but you know, everything from buying moisture meters or black light or, you know, equipment. So we did account for making sure all of our local boards of health have those items. So I think there's enough room under inspectional supplies, for example, to purchase those moisture meters or whatever, the routine test strips for food inspections, et cetera.
Kristen, can I just ask a quick question, please?
Sure.
Dennis did mention that he would like a noise meter. I don't know if that's something that would be shared or if Boylston could get their own or how that would
And
work.
Jen had mentioned that too, I believe, last meeting, but yes, I don't feel in Southbury we need our own one, but if there was some access to sharing.
So if you, I think that's something that I don't know the cost of that. I've only used the NIOSH app on my phone. And I've definitely used that to document like, you know, ambient noise and those, you know, decibels over ambient. But if there is a product, we want to make sure that we're buying the right one. So if you want to reach out to Dennis, or if you want to think about what type of meter, we might want to double check that with our subject matter experts. I'm thinking that Paul Hoffman's or whoever it might be at DPH to really tell us if that's the appropriate one that would stand up in court, et cetera, and we could look to add it. So if you can get that to me, the exact product you're looking for, or if you have a recommendation from the state or another board of health, we're happy to include that. I would think that couldn't exist, but to increase by $1,000 on that line item is not a big deal. And I just wanted everyone to keep in mind, these are numbers on the board, but the state has been very generous with us in letting us move between line items as needed. We haven't actually requested, we're pretty on schedule this year, but there is some level of flexibility mid-year and realizing at the end of the year, for example, we didn't do as much training and credentialing. We want to increase our supply line item. So there is some wiggle room, even if we were to miss it or underestimate the cost of a product, we do have some flexibility here. So send me what you have, or you can send it to me or Isabella, and we'll make sure to include that noise meter. And yeah, also not only the product, but if, yes, we want to share it, you know, if it's over $500, I just ask that you to reflect and see if it's something you want standalone, or maybe it's a regional asset that we could let live in one of the health departments that would use it most frequently, but have it available to the other towns too, as a consideration.
Okay, thank you.
You're welcome. Okay, so I just will open it up, and I'm hoping the next slide, Isabella's going to have those ideas, but just to look at these total numbers, or go back one, sorry, 1 second, Isabella. The last two line items. So again, the contract amount for this year, the total available for fiscal year 24 is about $460,000. Right now, with everything as you've seen it presented, it's our numbers at around 390,000. So that's a difference of 70 that we need to talk through on the next slide. We always do want to just be safe and sort of maybe hold out around 20 in case one of the employees were to elect a family plan that we weren't considering. So I think, and you can go ahead and proceed to the next slide. Thanks, Isabella. We're really thinking about, you know, under this grant in particular, surplus or, you know, unallocated around $50,000. So we had circulated some of these ideas via email. Again, these are only ideas. Any of them would require DPH approval, and some may not be allowed under the grant. So I know one thing I might have got Southborough, for example, excited is we have a great plotter scanner for full size plans in our office, and it's really let us do work remotely or send them to our septic inspector. It's a great tool, or even for residents, be able to quickly scan a full size plan and email it to them is a great tool. I could tell you that under this grant, I did check on that one in particular. We were told under the PHE grant that we're talking about now, it's not an allowed expense. They consider that a capital purchase. But if that's something you guys are still interested in, we can't always ask under the contact tracing grant if it's allowed. So, you know, they each have
right. I can again, with that information, I can again speak to our folks, but building is nice enough to let us use ours. I, you know, asked building, and that's what we do. And they're okay with that. They also said that their quality of their printer was good. I mean, it was fairly new. I checked on that too, but they have been, but they have been generous with their letting us use their large scanning. So I can see, but I don't know that we need to go to extra.
So I guess on that topic point, Sarah, do you have how does the health department in Boylston handle like large plans? Do you have the ability to scan them?
Ooh, I'd have to ask Melanie, to be honest with you. I'm trying to think.
Okay. Well,
I'd have to ask
us right away. We couldn't even do that large purchase under this grant, but as we get to the end, it won't be looking at the contact tracing. It's something to keep in mind. So I'll just quickly read over this slide. You know, we're bigger projects that we consider both with this funding source as well as the contact tracing is to do a regional community health assessment or community needs assessment, as well as considering community health improvement plan, or also known as a strategic plan that would be contracted through a third party. Likely to be over, you know, our number and procurement and RFPs, and you know, it's a process. So that's something every objective we have now with this grant, we have to think with that health equity lens and focus. And so we'll talk about the work plan a little bit, but you know, just thinking about how do we address health equity, or how do we best connect to our food establishments. So There's some discussion about translating health materials or inspectional materials or applications. We are considering expanding nursing programs. We're looking into maternal services, or, new moms or new welcome packets for babies in town and families. CPR classes. One of the things too is, if we want to look to expand sort of a standard operating procedure or try to look to develop that either through a third-party consultant or internally. Tobacco control, ability to contract out services if needed. Boylston, Northborough aren't part of a collaborative. We're hoping that Framingham will be successful in a recent application, putting us all under one umbrella, but that's another option if that doesn't come through. Again, expanding technology software, we talked about a little bit. There is a new pool module that Westboro is using currently, and they're testing that out. That's a newer product. There's also a smaller product where they have basic forms like camp checklists, and those aren't big money. It's around $500 per user if you want to use their checklist. In Northborough, we only have 5 pools. And so or 4 at this point. So it's easier to use hard copy. It's not necessarily worth it, but I can send information if we want to think about expanding the relevant software. And another project I'm really passionate about, I don't know if it's allowed, is trying to digitize some of our Board of Health files. One thing that came out of the cart was record keeping and management of reports and records. And so the idea is, could we contract with a third party who could come in and work to digitize? My vision is not necessarily to get into cloud-based and change. I mean, a lot of our towns need to do that at a large scale, but just, can we get them saved on a drive? Can we have somebody work through? So I don't know. That to me, I think it's a project that could qualify because it was called out in the cart. I guess if we could do a little around the room and see, do you have files in your Board of Health office? And we couldn't do building. So I know there's a lot of health and building files mixed, but health specific files, do you have files that you would be interested in having digitized by a third party?
Is it, would the septic fall under that?
Could possibly. Pool, housing inspections, old food inspections, Board of Health meeting minutes. I mean, I think anything that relates to health department permits. And think of the cart, think of when we did the assessment, all those documents they asked for. I think anything that, falls under that could work. But I think they draw the line, if your septic files are mixed in with the building department and electrical files, probably no, but if it's just septic Board of Health files, that could qualify. We could inquire, and it would be dependent upon a vendor.
I believe Southborough is interested. I didn't, in the email last week, it didn't have this, so I haven't checked this with our admin, but my understanding is we definitely have our own septic files, not building, and we have done approximately 50% of those, but I think we were interested. I just don't think in our current workflow, we would get to them. And so we are interested. We have well permit files, we have septic files.
And I'll just add that the SOPs and the digitizing files were on our goal list from last year. So that's definitely stuff that we as a board have discussed and would be supportive of.
We're having a Board of Health meeting Monday. And I will bring all of this up and ask them, and I'll get back to everybody.
So sorry.
Muted.
Oh, yeah. So again, we're looking at somewhere around 40,000. I think if we put out even digitizing, it would be above that. So we're going to be looking to complement our PG and what's allowed, but I think we'll start asking the questions. We can start reaching out to possible vendors to get some ballpark numbers, see where that's going to work with our accounting department's procurement and all the rest. And we'll go from there. Anything else that's sort of that we haven't talked through as a possibility that you would like included? Are there any items that we haven't addressed, products or other health needs or staffing ideas, et cetera?
Our backup inspector is probably not a viable candidate anymore,
Mandatory.
although I haven't been told that yet, because we haven't needed to use him. But my understanding is he's taken a larger role somewhere else. And if you have any ideas around, even when Dennis is on vacation, how to handle that, that's definitely an area that we have a gap.
Two towns, right, there are two towns there.
So
Not-
speaking specific to septic.
Yes.
Septic inspections, okay,
Yes.
plan review as well and inspections.
I mean, I
Mm.
think the plan reviews, we can probably work around
We get
to get
exactly.
it
Right
done.
now, we've gotten around that. I don't know about Boylston, but we get around that. But we do, same with Boylston, the septic
So
inspection.
it's more like the time, like if something needs to be done in that week that we don't have him, and Sarah, you probably have the same
Yeah,
concern.
it can be two and
Um,
a half weeks, right?
But the plans, I haven't heard that we have, I mean, I think it would be great if the backup could do
Great, but we
plans.
can work, at the moment, we can work around it, but that would be great.
Okay, I think the one easy solution, I'll have to run it by, we are in Northborough, we do it through our regular Board of Health budget. But the town of Northborough does have Scott Moles, who is a temporary, our part-time employee. If you
Okay.
know Scott Moles, he's the public health director in Holliston, and he does about 220 plan reviews and inspections a year. So that many reviews as well.
Okay,
So we've used Scott as a backup. I think that's our quick and easy, and I could talk to DPH about maybe adding a line item here for, a temporary inspector or backup inspector, with, let's just say $5,000. I have no idea, but we could
Yeah.
tie a line item to that. In Northborough, given we already have Scott on staff. I think the hardest thing, at least I'm thinking of Scott, or we could look at, it's hard finding qualified septic people.
right.
Do you both anticipate between Boylston and Southborough that you have like set weeks when you need that coverage? Or is this like a backup
No.
for a last minute sick day kind of thing?
No,
No.
this is, Dennis, I think knows a couple months in advance. Would that be about, you guys would all agree? No, that he has a planned time, he takes time. It's planned in advance, but it can be more than a week. I think, for example, last year, maybe he did one bigger trip, might have been 2 to 3 weeks, and maybe one shorter one, about 10 days. That
Okay,
was kind of last year's rough schedule.
I think
Yeah.
that's something we could either build in with our existing staff. Michael is taking the soil evaluator class today. That's why he's
Oh,
not.
okay.
So Michael will be certified to observe any of your soil testing deep hole, which
Okay.
is a huge benefit, and that's an in-house ability. So that's great. And I would say as long as it's a backup option and it's not all the time taking on that role, that's
Right.
not a big deal. And then we
Right, for emergencies or something, right, but right, his
Yeah.
plan for the 3 weeks off, right?
Yeah, so I will look, and I think Isabel will make a note to add a maybe backup staff, a backup like septic inspector line item, other staff here. And I think we could find a way to do that. I think it's a great idea.
And I just think with what we're looking at from a, public health, like joining forces perspective, the more that we can build it within our
Right.
towns together, I just think there's more value in that, right? So if you're a backup to 3 towns versus a backup to 1 town, I just think that's more attractive to somebody, maybe. So I guess that's why I'm bringing it here. I mean, we've been able to handle it within our budget when we've had to call out for people. So it's more just how do we create more resources and options for all the towns together?
Do either of you, Boylston or Southborough, our hardest part is finding somebody qualified to do the work.
Yeah.
So for you, do you have anybody in mind qualified and it's about the money, or is it more just about finding the person?
It's about finding
That's
a
available.
person
Okay,
for us.
yeah,
I mean, we've been fortunate that Dennis has been reliable to be able to get it done in the hours that we get from him. So that it's really just, you know, he needs to.
Yeah, and it makes sense combining it with Boylston, because it would say sort of be that same 3 weeks for that person who's
Yeah.
doing it. It's not going to be too much difference for them doing both towns versus having a different person at each town.
Right. Right. Yep.
Okay, so if you have those dates, definitely send them over to us because we might even be able to have some in-house capacity to help
Okay.
one another. As well as I think that's a great line item addition of like a temporary staff or temporary hours for backup inspectors to give Northborough the flexibility to pay somebody to fill in that work, and either somebody we have on staff or to look in the future of getting additional backup inspector for the region. So great
Okay.
point.
Great. And
Any-
you know, Kristen, maybe you even make it a more general, like, emergent inspections, because let's say Michael's on vacation and there's, you know, inspection he needs to do at a house for that is before he gets back. You know, so we could even expand it to that too, if that works.
Yep, we'll look to make it generic. Yeah,
Yeah.
so it could cover any health inspections. I like that idea. Okay. Great. Any other ideas we should consider? Okay. So sort of our next steps regarding this grant is we're going to create line items to fully expend the grant. Okay, so we're not going to look to not request the full amount. And I'll try to go along, and we have a meeting scheduled with Cassandra Anderson, who's our primary or program coordinator under PHE, to further expand these and to fill in those line items. So, okay, excellent. Next slide, Isabella. So another thing we were looking to expand just along these lines, on the left, there's a flyer from Be Well Northborough. We've been running CPR and AED trainings in the town with some ARPA funding for Northborough specific. And then on the middle, there's a great screen grab Isabella found from the town of Needham, where their public health division, you know, routinely offers CPR classes for interested community members. So our nurses, Erin, and I believe Taylor and Penny, am I right? No, just the Taylor and Erin for now are going to be trained to be instructors through American Heart Association as our plan. I believe the contact tracing grant is going to cover the cost of the dummies, and we're working out details. But this is also probably a program line item where we're looking to set aside money, if it's allowable, to be able to offer these free or reduced cost CPR AED trainings, if that's something that you were interested in your town. I know certain towns, I believe Westborough, they're fire department might already do this work, but is it something that Southborough and Boylston would be interested in offering for the public?
Yes, South will be doing this. Taylor's getting trained. Yeah.
Yeah, Boylston would be interested. Yes.
Okay, so we'll probably include a line item there that would help. What we'll have to see what's allowed. Sometimes the state on the other one, they're willing to help pay to train the trainer, but they won't pay for an individual CPR card from someone through American Heart Association, the $15, let's say. So we'll figure out what's allowable under the grant. What I'm envisioning based on staff capacity, I don't want to overcommit Erin, is, but like, could we get to the point of just offering, you know, every 2 weeks, a course in one of the 4 communities, you know, so it would just bounce around through libraries, another venue, or at least once a month. We'll have to see what's realistic with workloads during the flu season and immunizations. We might not be looking to offer, but maybe the month of September is a good time where we could try to offer a few. So there's some details to work out there, but that's, I'm glad to hear you guys are interested. So we'll keep proceeding with that.
Kristen, for those courses, would you have the public take the online course prior to the practical with Erin or Taylor, whoever's running the class?
That's a great question. We did 2 different models in Northborough through the Be Well program. We did it with our fire department, and we did the blended learning environment that you talked about, Chelsea. So it was online for like an hour, and then in person for, you know, about an hour and together. The one thing that we found, it's just a lot of paperwork to make sure people get the link and they actually are able to open it, and then they get to the class, and I didn't have the link. And so the model that we did through Be Well for the public, we just did all in person. The trainer was able to get the entire course done. Again, it's just AED. This is not first aid, AED CPR. So we found that just having people show up for 2 hours and there's no computers involved and no missed logins and paperwork was just a streamlined way to do it. So from just paperwork end, I like that. The people like the in-person, but most of these training programs, Erin could speak to it as well. You know, they do offer blended, but for the general public, it's just a lot of work just to save an hour of time. That if we could just do 2 hours in person, it seems like less paperwork.
So
Go through the training, we've had the ability to do either. So it really could be, once we get to that point, it could be whatever we want it to be.
okay.
Like,
I mean,
Even
If,
if
like,
like
you had
provided both, then, you know, we decide to offer like a blended at some point, like we could do
Yeah.
that.
So I've organized a few for like our mom group in town, and we've done the blended partly because of the time commitment, just with like people with younger kids and trying to fit an hour in. So it actually has worked pretty well. So maybe it just depends on the audience that we're working with. So it sounds like your intent would be to be flexible and do it either way. Okay, great.
yeah, I think like if we had like kinder group Chelsea or something, like we could
Yeah.
offer it like half virtual, half not. But if
Yeah.
it was like just for the general public to sign up, we could just do a full class.
Right.
The other thing that I think would be really great if we could do it would be that prior to every sports season, every coach has to do this. Because it's not required now. And I just think it would be a benefit for all residents, at least if one coach from every team gets trained. So if, you know, I'm happy to help coordinate on, at least on the Southborough side, all those, you know,
Are you
boards.
talking about the rec leagues or the school? You're talking about the rec leagues.
I'm talking about like Southborough youth soccer.
Right, the rec league.
And like, I just think the trainings that you go, and personal experience, the trainings that you go through to become a coach doesn't include a lot of this. And it's so important. Like a kid gets hit with a ball in the wrong spot, you know, you're against the clock. So I think, you know, and working towards getting AEDs at all of our fields. So I know we're working on that in Southborough, because I think Finn is the only one that has it. So I would advocate that every organized sports league get trained.
I think that's a great idea too, because I think, you know, it's all over the news, you know, the NFL, it's everywhere now. The people are kind of thinking about that. So I think that if that were to happen, people would be behind it.
Okay. Again, it's a time commitment, but
Yeah, I only worry from a staffing capacity because there's certain ratios that have to be met, and like especially, you know, that could be a lot of people in a short amount. But I think one option, we could talk to the state whether or not we could contract to, you know, if that would be allowed or it's only in-house. So we'll figure it out what's allowable. I'd like to even say with that level or scale that even contracting another group to support that. You know, finding a third party, et cetera, because it's like you said, Chelsea, it's a tight time of year and it's a lot of people at this window. And so finding that out. Yeah.
I mean, I may know someone that would be willing to help.
Okay.
Who's done all of baseball and softball.
Yeah. Okay. So yeah, we can talk more on that and we'll inquire, you know, generically sort of what's allowed.
Okay, that's great.
Under the grant.
It's 2 years. So we could also, the goal could be to get half done this year, half done next year,
Yeah.
and then it flops too. So it's not like every other year there's like this giant list of people that need to be certified, and then next year nobody.
Right.
You know.
Right. And I do think we have some fire department employees who could also do it. So we could also maybe partner with them to just spread. So I get the resource constraint, but.
Tim in Westboro is also trained. So I, you know, through his department too. So he is another certified instructor.
Okay.
I'm constrained with him too, but.
All right. Thank you.
Awesome. So next slide, Isabella. Okay, so I guess this next slide is gonna move to the contact tracing grant. I guess before I forget, I think at the end, we just want to look at there's consensus to submit these draft budgets, or at least the PHE one will be due. I think it's the end of next week, Isabella, is that correct?
May 26th. Yeah, next
Okay.
Friday. Whatever
Okay.
day.
So I don't, we don't, this isn't a formal vote required, but I don't know, is there a general consensus on the PHE to submit it as proposed with the additional items we added? Okay.
Right, as discussed here.
Okay.
So you're
Okay.
gonna leave the 70,000 as flexible?
I think we'll have to tie it to one item or another. So I
Okay.
think, what we'll do is I think there'll be some back and forth emails, at least informing you what is allowed. And then I think what we'll do is I'll propose to everyone what we're planning to submit. And if people want to have a meeting,
Okay,
another meeting, based off that, this is really idea forming. And now that we'll see what people are interested in, what the grant will allow. So I don't think we necessarily need official vote unless you say, I don't agree with that, and let's have a meeting to discuss, and we can do that as well. So I guess I'm not hearing that we need to make any changes to the proposed moving of the epidemiologist, or you understand the fringes in there and how those line items, and then, we'll be looking to fill in the 50 to 70,000 line items. And I think we'll take back your ideas and see what's allowed and go from there. I see breaking it. Well, so again, the additions we'll be looking to do is a sort of backup inspectional line item for, part-time or just backup inspector. I'm saying I'd like to put in like around $5,000. I'm just estimating. I don't see it being a ton of weeks as we discussed. And then we'll look to add an additional $360, administrative inspectional license under the relevant. And then we'll be looking to plug in the other, again, those ideas we had, for example, community health improvement plan or digitizing are going to fall into one of the existing categories there. So we'll see what's appropriate and look for an email on that. Regarding our COVID-19 grant, or the local health support for COVID-19 grant, we also refer to this as the contact tracing. This grant is currently supporting Penny Giacobi, who's doing our MAVEN investigations and supporting the 3 towns with that work, as well as currently supporting Isabella in that position, epidemiologist we're moving over. So again, the budget for this year's contact tracing grant was $219,000. That was our core set, 160 plus a rollover amount of almost 60,000 for fiscal year 22. We're anticipating, even with buying the, a projector for the nurses to use to present and some other items that have come up, that we're going to have a surplus of almost $100,000. And so we are talking about a lot of money being rolled over with that fiscal year 24 budget. So we don't yet have a due date for that budget from the state. So once you remove Penny's position at 24 hours, I think we're going to have, a surplus, and you remove some of it. We're looking to spend out about $200,000, which is a lot of money. So a community health improvement plan or community health assessment can cost a lot. When we received our back, if you may remember meeting with HRAA years ago, they were estimating over $100,000 per participating community. They are just one of the companies that do it. I know Metro West is doing their community health assessment right now. Isabel, do you know who's doing that for them? What vendor?
I thought it was Health Resources in Action. I can double check.
Okay, HRA. So again, with that large amount, I'm going to start to, if you have interest, it needs to be big one-off projects that we can contract, because I did talk to my assistant town administrator. What if we wanted to add a health communication position, or what about a outreach coordinator, health communicator, and all these? And, her concerns, I think are very valid, is we have 1 year left to the grant. If we all vote on a great job description and we hire them and you post it, it's going to take 3 months to get them, take 6 months to train them, and then they have three months of work, and then it's all over. So I don't know if investing these funds, although it's a lot of money.
This one has limitations as well, right? On what can.
Yeah,
be
Isabel,
used
can you go that
for.
next slide
And-
there? Did you have that?
Could the digitalization go under here?
Possibly. Did we have the, okay, so this is what we're allowed to do. So again, this is the scope of services that was recently revised for the contact tracing grant. And it was revised because DPH no longer requires every COVID case to be followed up on. And so items 1 through 6 are sort of routine disease investigation work. Erin took the lead on developing a standard operating procedure regarding Maven and these investigations. That's been reviewed by Taylor and really circulated around. So we feel very comfortable that we are meeting with our existing staff. Items 1 through 6 of the scope of services. So what else can we do with this grant? And what else do we, it's everything in item 7, which is a catch-all of everything, as long we have to meet items 1 through 6. So if we're not meeting our requirements on Maven investigations, we can't do other stuff, but I believe we are, and we're compliant. We have an SOP and adequate staff at this time. And then we can do anything else that supports core health activities, like a community health assessment, for example, except for vaccination. And again, this is because it's a federal grant and there's a separate grant specific to vaccination. So that's our limiting factor. So regarding what we can do with that money, it's pretty wide open.
And remember in the possibilities for the PHE grant, the standard operating procedures with, backup documentation, and would that potentially fit here?
Yes.
Yeah.
I believe so.
So
more ideas to come. I mean, unless there's something else you want to add, I think we have yet to solve the contact tracing grant. We're really focused on getting the PHE budget and work plan together. And I don't know, Isabella, what's next for our slides? Do you any other comments? Because Isabella's been the one working really hard on the work plan for PHE and those ideas. So. Okay, so what do we have next, Isabella? Anything that you wanted to add?
No, but just talking about disease investigation, so kind of moving off of the grants, if anyone else has any ideas. So we don't have a due date yet for this grant, so we can let the group know once we receive that.
And we could likely vote that next budget, or to look to review or take comments on that budget at our regularly scheduled June meeting. So I think that should work. Okay. All right. So that's it. If ideas come to you, send them along, but I'll hand it over to Isabella from here on the slides. Thanks.
Perfect. Well, I'm going to hand it over to Erin because she did all the hard work on this.
I had a lot of people read it over for me though, so thank you. But yeah, we worked through basically what we're already doing and making sure we were checking all those boxes for the new requirements for the contact tracing grant, making sure that we're hitting all of the key points in all the Maven investigation, and basically just put what we're doing down in paper to formalize, who is the point of contact and update some of those types of things, and sort of a little bit of a how-to if somebody that's filling in doesn't do it on a daily basis, needs to cover, like a vacation or something like that, they'd be able to pick it up and be able to kind of go through and give them the flow of what should happen and what the expectations are. So we did put that together, and Kristen's going to share that with Hillary Johnson, who is very well known in the Maven world, but she is also now the MDPH contact person for the contact tracing grant as well. So kind of get her blessing that we are doing everything that we need to do in those items 1 through 6, so that we can move on to doing all the things that would fall under number 7.
Any comments, questions? All right, perfect. And then just a little COVID-19 update. So for contact tracing and case investigation, as far as we know, Erin has told me all the nurses, they've been doing under 5 and over 65 or 65 plus
65 and over, yeah.
For contact tracing and case investigation. So we are potentially or proposing that we discontinue individual case investigation and contact tracing, which is in line with the state and federal public health emergencies that have ended like last week, 2 weeks ago, as well as the MDPH recommendations that actually were dated back to December 2021. So does anyone have any comments about that? All in favor? And of
Okay.
course, we will still be doing, I still communicate regularly with daycares. And of course, if any outbreaks at like assisted living or skilled facilities, we would obviously communicate and see what they needed.
Mhm.
Do you want a motion to support the discontinuing
Kristen, do you
individual
think
case
that-
investigation vote? Or just?
I don't know if we need it officially. I
Just
think
a-
every Board of Health has really moved that way. I think it's more that we just want you all to inform your local boards of health that while our nurses have been calling, it's really not recommended and it's not really practiced at this point with this, the COVID state of emergency. It's all over. We just want to go in line. If your board, I definitely please relay this to your board that they realize we're no longer making calls effective with this meeting date. Anything can be revisited. We have the capacity in the nursing staff. So if you have board members that think we should be doing above and beyond, we're happy to discuss that with you. But I think this is what's recommended. It's been recommended for a really long time at DPH. I think we continue to make calls long beyond most. And now it's starting to just cause confusion and it's just, So we're going to discontinue COVID-19 calls, but continue to be a resource and monitor, like Isabella said, for outbreaks, et cetera, and provide support. But okay.
All
So
right.
if you need additional work, done around COVID-19, that's something we could work independently with your town if your board was passionate of making calls along those lines. So just reach out separately to Erin if that's the case, or Isabella.
Great. And then Northborough just received a ton. Kristen, I don't know exactly how many. Thousands?
1,500 free, so 1,500 free test kits. So all of us have been asking about, well, what about test kits? Many of us have been distributing through our libraries or town halls. The kits we last received from the state, the eye health test kits, some of those stopped working. The controls were bad. So you might want to check them if you have boxes. So we had to discard 6 cases in Northborough that just the controls stopped working, but they were not expired. They were still within the window of time. But most of all of those kits we distributed, and we were getting questions from the community, especially that insurance is no longer required to cover the cost of COVID-19 test kits, about whether or not we were going to continue to get them for free. So I can, if you haven't already, just send me a note. I didn't want to put this link in a public meeting, but there is a link to request additional test kits through NACCHO, and they came very well. You submit the form and then they magically appeared. I can't remember what I requested, but they sent us 1,500 test kits. So they're available there, and the state just sent an email stating that if you'd like to buy them. So it sounds like the state is not giving them out for free anymore, and it's on the state bid list, and it costs $5 a kit. So that delivery we received in Northborough was about $7,000 worth of test kits. So definitely recommend everybody request them and then share if you do have a need. But I don't know what it's going to look like in the fall. The ones we received, though, are good all the way through spring of 2024. Is that right, Isabella? Okay. All right.
Well, that was the last one.
All right. So we can stop that screen share. I think we do. If we go back to our agenda, I think we need to review and vote minutes. Is that correct? No, sorry. Or Isabel, could you pull up that agenda slide real quick? Maybe we just reshare it. Okay, so great. So we have worked through. So Isabella had sent around the meeting minutes of March 8th. I don't know if you had a minute to look at those, but we should motion to approve the meeting minutes.
I'm just waiting for any comments. I can make a motion to approve the meeting minutes from March 8th, 2023.
Great.
I'll second.
Okay, and any discussion on those meeting minutes? We do have quorum, so again, voting members that were present included myself, Jennifer Sullivan, Heather, and Sarah. So we have a quorum to approve those. So any discussion or edits to the minutes? Okay, and we'll move to a roll call vote. So Kristen Black, aye.
Heather Alker, aye.
Sarah Barrett, aye.
Okay, thank you. So those minutes are good, and we will have them.
Kristen, do you mind just emailing me those without the draft stamp?
Oh, right. So you can
So I can
post
post on
those.
the
Yep.
website. Thank
Yep.
you.
Isabella, can I put you on that? Because I forget. So you have that final copy. And then we are posting our meeting minutes to our town site, but it sounds like in Southborough, they want to post it separately. So what we'll do is now that they're approved, we'll send everybody a clean copy. Sarah, I don't know how Boylston's handling the minutes, if you need to post them, but we'll also include in that email the link to where they're posted in Northborough, just so if your town is asking where they're located, those are on the website. Okay, great. And then we have our future meeting dates were noted on the agenda. So Isabella, was that next one was the 14th? Is that right?
Yes, June 14th.
And hopefully that still works for everybody. And by then we will have submitted the budget on PHC unless we need to meet before if you have questions or concerns. And we'll have a draft budget. We'll be voting most likely on the contact tracing, or at least reviewing for your submission. And I think that's officially there. If there's any other business that you'd like to discuss. Okay. Anyone want to make the funnest motion, the motion to adjourn?
I'll make a motion to adjourn the meeting.
I'll second.
Okay. All those in favor will do a roll call vote. Kristen Black, aye.
Heather Alker, aye.
Sarah Barrett, aye.
Okay. Excellent. Well, thank you, everybody, for joining today. We appreciate your feedback and look forward to getting you some more information.
Great.
Thank you.
All right.